We're here again at Kalo Dental in Carlton, which is in Sydney South, and we're here to have a look at what they're doing with their Kalo OP3D. And you see the system here. This is where Peter Bakouris takes all of his OPGs, lateral cephs and cone beams. So you can see this room is really well designed. The system can be installed on an angle, and is the only system in the marketplace that has a dedicated X-ray source for lateral ceph imaging. Let's go and have a chat with Peter. G'day Peter, we're here to have another chat about your case today. How things?
Good, how are you?
Good to see you again.
Likewise.
Here to have a look at one of your cases from the OP3D. This is a cone beam CT case. I want you to give us a look at what you've done and how it's helped you.
We've got an interesting case of an overseas patient from Europe, and where she's had the whole treatment, the whole kit and caboodle, root canal treatment, crown done, and then moved into Australia. We're in quite a bit of pain. Having taken a couple of PAs, we couldn't work out what the issue was, and made all the adjustments, did some gum treatments, checked the bites. The patient was still in pain about a week later, so we got her in, took a CT scan, again a small field of view with about 3 teeth in the range that we were looking at, and basically on CT straight away you could pick up and see either a little bit of a vertical root fracture or a chronic infection at the tip of that tooth, and it quite well shows that up there. So we can see around that buccal root, there's quite a lot of the wall of the buccal bone that's basically eroded and missing, and when you look at that on CT scan, it's obvious. The patient had reservations about taking the tooth out or continuing treatment, so she wanted us to run it past her dentist overseas, which is easy to do. We took a screenshot, sent it off, emailed it, and within a day he had responded to his patient and she went ahead with her treatment. So it's a really good way of showing how that digital flow works as well.
Yeah, for sure. Wonderful. And you take many larger fields of view or mostly smaller fields of view with depending on the case?
It depends on the case. Anything where you're sort of looking at endo, you don't need anything more than 1 or 2 teeth. Obviously if you're looking at an arch or you're doing a bit of a build-up case, obviously you can do a larger field of view. More for implants, you probably want more of a bigger field as well.
Can I ask, you using endo resolution, is that or a high resolution setting?
This particular one is not the endo setting, it's just the higher setting, which is a standard one, but we can go one step further into endo.
Yeah, the image quality is fantastic. That's great. Thanks so much for sharing.
Thank you.
Thanks, Peter.
Thanks for your time.